Hi friends, welcome to all, and this is the continuation of the video lecture. In the previous video we discussed about the etiology and clinical differences of the rhabdomyosarcoma and chondrosarcoma. So now we are discussing about the radiological aspect and the histological variant of the rhabdomyosarcoma along with chondrosarcoma. We will also discuss here. In the description you can go for etiology and clinical discussion to rhabdomyosarcoma and chondrosarcoma. You can check the link and see the video lecture, and this is the part 2 video lecture of the rhabdomyosarcoma and chondrosarcoma. So now we begin the topic. In this photo we can see here the OPG, and the left side of OPG shows here the ill-defined radiolucency. You can appreciate here there is a soft tissue haziness, and the density of this area is clearly visible, different from the other area. And you can also appreciate in this area osteolytic destruction is also present, but soft tissue haziness you can easily appreciate in this area that extend from the 4-5 region to 4-7 region. Whereas in chondrosarcoma there is ill-defined border, and the lesion is extending from the two area of the along the root apices, and it extend up to the 2-6 region, and there is ill-defined radiolucency we can appreciate here. And sometimes the OPG also reveals about the periodontal ligament space at the apical surfaces. In a few cases we can also see the periodontal ligament space widening. Apart from that, the chondrosarcoma have great picture in the another view of the long bone. So we can go for the other long bone X-ray, and here you can see when the chondrosarcoma is aggressive and it perforate the cortex, then what happened, there is Sarpi's fiber that become stretched, and after the stretching of Sarpi's fiber, when the X-ray fall on these Sarpi's fiber, it creates a sun ray appearance. You can easily visible here the sun ray appearance. After the sun ray appearance, sometimes there is Codman triangle. In this case it is not visible clearly. Now we are going for the another picture, and in this radiograph we can see there is ring and arc calcification. So in chondrosarcoma, the ring and arc calcification, these are the rings and these are the arc. So these are the ring and arc calcification. It is very famous in the case of chondrosarcoma. Apart from that, the one thing is very common, that is your popcorn calcification. So in the popcorn calcification, there is you can see here there is osteolytic destruction of the medullary space, and there is endochondral hyaline cartilage ossification. These are the endochondral hyaline cartilage, and you can appreciate in this picture. Here also there is popcorn calcification, that is nothing but this is the endochondral hyaline cartilage ossification. So in this picture, apart from that, we can go for CBCT, and the CBCT of rhabdomyosarcoma, you can easily visible the soft tissue extension and the soft tissue infiltrative to the adjacent areas in case of rhabdomyosarcoma. Whereas in chondrosarcoma there is CBCT it reveals there is obstruction in the sinus area, and this sinus area obstruction can go towards the contralateral side, and you can see here the half sinus area is also get affected. So this is the CBCT of chondrosarcoma. Apart from that, when we go for MRI, we found here there is T2 high intensity wave recorded by MRI, and this is T2 high intensity, and in chondrosarcoma it is also recorded both side. Here the T2 intensity is very high, and here also. So these are the cases where we found the radiographic differences between rhabdomyosarcoma and chondrosarcoma. Rhabdomyosarcoma is a very aggressive and fast growing lesion, whereas chondrosarcoma in aggressive variant, just like mesenchymal chondrosarcoma, it is very aggressive variant. Apart from that, we go for another video lecture to the histopathology and histological variant. You can see this video, continue this video. If you like, please share and subscribe my channel. Thank you so much.